Imagine you have a female body and a female name, but inside you feel like you're male and you want to be male. Or imagine your family and your friends refer to you as him and he, and in your mind you see yourself as her. And does this make you feel bad about yourself, give you anxiety, depression, and even make you want to hurt yourself? That's gender dysphoria. And that's what today's video is about. Hi, I'm Dr. B. I'm a medical doctor, and today I'm going to explain the medical condition of gender dysphoria. And I'm going to use the Diagnostic and Statistical Manual 5th edition, or the DSM-5, which is published by the American Psychiatric Association, to help me. To understand gender dysphoria, we first have to understand the difference between assigned gender and gender identity. Assigned gender is assigned to you usually at the hospital. It's at birth, and it's based on biologic sex. It's based on the appearance of the external genitalia like the penis, the vulva, testicles. It's very visual. It's common and generally accepted knowledge to nurses and doctors and parents. Gender identity is different. It's an individual's internal sense of their own gender, and it is a fundamental part of a person's identity. And the key is that it may or it may not align with the assigned gender. Now, this difference between assigned gender and gender identity can be a source of significant distress, discomfort, and anguish, and this psychological distress is gender dysphoria. Now, according to the DSM-5, gender dysphoria can be diagnosed if 2 of the following 6 criteria are met. The first criteria defined by the DSM-5 is an individual who has a real marked mismatch between what they experience as their gender and their primary and secondary sex characteristics. So what does this mean? Well, primary sex characteristics refer to the reproductive organs such as the penis, the testicles, uterus, ovaries. And these are typically used to determine an individual's assigned sex at birth. And secondary sex characteristics refer to things that come later. These are physical traits that develop during puberty, largely from hormones, and they're not directly related to reproduction, but they're very associated with stereotypic male or female, such as the development of breasts, facial hair, or an Adam's apple. So for example, a person assigned male at birth may experience extreme distress related to the ongoing development of a beard, a mustache, and a deeper voice. This individual may feel, based on their internal view of themselves, that these changes are incongruent with their gender identity, and they really desire to have a more feminine appearance. Conversely, a person assigned female at birth may experience a significant volume of distress related to development of things like menstruation or the growth of breasts. And this individual may feel that these changes are completely a mismatch with their identity and their gender, and they may desire to have a more masculine appearance. Now, criterion 2 for gender dysplasia in the DSM-5 states a strong desire to be rid of one's primary and or secondary sex characteristics. Individuals who received gender assignment as a male but see themselves differently may shave their legs at the first sign of hair growth. Individuals who were assigned gender female but really see themselves as male may bind their breasts. They may walk with a stoop or wear loose sweaters to make their breasts less visible. Or there are more permanent steps like hormone replacement therapy or gender confirmation surgery to feminize their physical appearance. And this can include wanting to have breast augmentation surgery, vocal feminization therapy to raise the pitch of their voice, and facial feminization surgery to soften the contours of their face. Criterion 3 for gender dysplasia in the DSM-5 is a strong desire for the primary or secondary sex characteristics of the other gender. So an assigned male individual may desire a smaller frame, wider hips, softer skin, and to present a more feminine appearance. And they may desire to have female genitalia. Whereas an assigned female individual might have a strong desire for a broader chest, more muscular physique, a deeper voice, and a desire to undergo gender confirmation surgery to achieve a more masculine physical appearance. This can be phalloplasty to create male genitalia. Criterion 4 and 5 for gender dysplasia in the DSM-5 is a strong desire to be of the other gender and a strong desire to be treated as the other gender. Examples of this are an assigned male who has a strong desire to be addressed as a female, to be referred to with female pronouns in social and professional contexts, and to be treated as a female in other ways, such as being allowed to use female restrooms or participate in female-only activities, including female-centered support groups and social networks. Criterion 6 for gender dysphoria in DSM-5 is a strong conviction that one has the typical feelings and reactions of the other gender. Examples include an assigned male who identifies as a female and yet has a strong conviction that they have typically feminine feelings and reactions to social situations, such as feeling more comfortable expressing emotions or seeking out more nurturing relationships or occupations. They may feel that their current male identity is a barrier to fully expressing these feelings and behaviors. For an assigned female identifying as a male, an example of this criterion might be a strong conviction that they have typically masculine feelings, and they are really more comfortable when they're able to express themselves assertively and seek out competitive environments and physically aggressive sports, pursuing adventurous, risk-taking behaviors and activities that are viewed stereotypically as more male. Now, to reiterate, gender dysphoria involves clinically significant distress and impairment in social, occupational, or other important areas of functioning. But it's very possible for an individual to experience significant distress related to their gender identity without meeting the criteria for gender dysphoria. For example, a cisgender individual, that is someone whose gender and assigned entity are the same, that person can still have significant distress related to their body or their appearance and feel very self-conscious about their breast size or body hair. This can cause a lot of difficulty functioning, but this would not meet the criteria for gender dysphoria because this individual doesn't have a desire to obtain the primary sex characteristics or secondary sex characteristics of a other gender or to get rid of the ones they have. They just don't like the ones they have. Now, a final criterion for gender dysphoria is that gender dysphoria is not a symptom of a different mental disorder. For example, there are cases with obsessive compulsive disorder where individuals can experience very intrusive thoughts or doubts about their gender identity, leading to distress and anxiety, something that they cycle on over and over. And while their distress may be related to their gender identity, it is really a symptom of OCD rather than gender dysphoria. Similarly, someone with an entity known as body dysmorphic disorder or BDD can experience significant distress related to their body imaging. And this can include aspects related to gender, but this also doesn't meet the criteria for gender dysphoria, as it's really a symptom of a separate entity that is body dysmorphic disorder. Thanks for watching. If you've enjoyed this video, try these others, including a collection of shorts on a variety of mental health topics, or this video on narcissistic personality. If there are other subjects you'd like me to explore, leave those suggestions in the comments below. And please don't forget to hit subscribe.